back here with orthopedic spine expert Dr. Robert Watkins to answer your questions on Facebook and Twitter. Next up is Ricky 56. Is there any kind of surgical procedure that may have to be performed?
Yeah, it really depends obviously on the condition. Making sure the patient has exhausted non-operative care, that everything has been explored, that we know exactly what's causing the pain. And like I said, if we know what's causing the pain, we can generally help people with surgery. Then it's just a question of the risk-benefit ratio. Well, how risky is the surgery? Can we do it safely with newer technologies? And then what's the potential benefit? And a lot of people's friends and families tell them, never have back surgery, don't do it, you'll end up worse, everything else. But I see people all the time who are suffering in pain for 2 to 3 years that there is no other option in general except having surgery. And if the chance of the surgery helping them is pretty good and the risks are pretty low, then it can be worth taking the chance, and generally we can help a lot of people.
Next up is Leah 23. How about things like obesity and age? Do they affect getting arthritis?
Age definitely affects getting arthritis. The longer you live, the more likely you are to get it. And as far as obesity goes, surprisingly in the spine, obesity has never really been shown to correlate with back pain.
Wow.
And I know that's surprising because I have a lot of family members who come with patients and say, oh, he or she needs to lose weight, don't they? Then they'll feel better. And technically that's not exactly true. It has been shown that cardiovascular exercise 3 to 4 times a week does improve back pain. So those are somewhat related, but it's more getting out and moving and circulating your blood and being active and releasing endorphins that you get from exercise that helps the back pain. Having obesity can affect other joints in your body like your knees and your hips and can increase the pain and arthritis from that. But it's not been directly shown for back pain. It's more, but the exercise does help.
What about risk factors like family history? Does that play any role in developing arthritis?
Not necessarily. There is some family tendencies in certain families that are more likely to develop osteoarthritis. But in general, everybody gets arthritis, and it's not really one of those things you can blame on your parents for passing on to you. Pretty much everybody gets it. And so there are some family tendencies, but not very strong. It basically affects all of us.
Dr. Watkins, once someone's referred to you, let's say with back pain, what sort of diagnostic tests do you do to prove that this is arthritis and might require some therapy?
The best diagnosis for osteoarthritis is actually by a simple history and physical exam, which we tend to skip over at times in our rushed world, but it's really important. The history alone, if somebody wakes up and when they first start to move, they get pain in their joints, that's arthritis almost by definition, because your joints stiffen up overnight, or when you're sitting and not moving, all the fluid leaves the joints. So when you first stand up, it hurts because there's no lubrication in the joint. And that comes back to you have to move in order to lubricate the joint. So just that alone, if you wake up and you first stand up and you have pain, that's probably arthritic pain. Same thing happens towards the end of the day. As the joint starts to wear and fatigue towards the end of the day, the pain can come on at the end of the day. Then as far as the x-rays and exams go, a basic plain x-ray that you can get done in a doctor's office can show narrowing of joint spaces, narrowing of the disc spaces, bone spurs, some mechanical instability, and different findings that are pretty obvious for osteoarthritis. We have other tests, especially in the spine, such as an MRI or a CAT scan, that are more detailed tests that show specifically the nerves and specifically the disc and what it looks like, which are the next step along the way. But it starts with a basic history and physical exam and work our way up from there.
I'd like to thank Dr. Robert Watkins for joining us here today. I know that was outstanding information for you guys. And if you missed any of it, please visit emPOWERme.tv on MD-VOD to get any of this great information about arthritis and back pain.